Honorable Minister, I know the partners, are really looking forward to working, and they have a lot of interest in some of the programs for Ethiopia and how they can move some of them forward. So if we could hear from you in terms of, your vision of how you see some of the programming for women's health, but specifically women's cancers moving forth, and how some of the partners can work with you.
Thank you very much. Thank you. Is it on? Okay. Thank you very much, and good morning, everyone. I didn't expect to be speaking first. Okay. So it's really a pleasure to be here with everyone to discuss this very important topic of women's health, and particularly women's cancer, which is now becoming a more burden and global burden, but also in countries like ours, in developing countries like ours, also the rising incidence of cancer is really a critical topic for us. In Ethiopia, maybe the number of cancer patients, we have a challenge in terms of really registering the actual number of cancer, but the estimated cases is more than 70,000 cancer cases that we have. And out of these, half are those affecting women, particularly cervical and breast cancer, with most of them being diagnosed very late stage. So due to lack of access, it's around 15% of cancer patients who get some form of care. So you can imagine how devastating that can be, and many women arrive very late in for care, and most of them don't even reach to that. So as a country, we've been trying to design with the increasing burden of NCDs overall, prioritize it in our healthcare strategy to address NCDs and women's cancer. And a national cancer control plan has been designed for the whole continuum, from prevention to care and treatment. And because of that, just to highlight few preventive measures, we have introduced HPV with the support of Gavi the last 3 years, where we were able only to introduce for a 1-year cohort, so 14-year-old girls, which we are planning to expand. So far, 4 million girls have been vaccinated. And screening for cervical cancer through VIA has been expanded to our primary care facilities and cryotherapy. So with that in mind, but the issue of cancer care and treatment has been a big challenge, with inadequate facilities, inadequate providers, very few providers that we have trained in the different fields. So a big focus has been now also to expand the care in terms of radiotherapy and chemotherapy. And there's a big initiative that we are expanding from one radiotherapy center for more than 100 million people that we've had for many years to now 6 additional centers underway. 2 of them have already additionally started. So with the biggest, Addis Ababa University, my colleagues, I see them online, being upgraded to the best treatment now, the state-of-the-art LINAC machine. Now we have 2 other centers operational and 3 underway. So this will really enhance the care that we plan to give, but it's not easy. It's not just about bringing the radiotherapy machine and starting the care. It's about having the right workforce with a different mix of workforce being trained, radiotherapy technicians, medical physicists, oncologists. So there's now a very good program that has started, which I'm sure many of you know, the hub and spoke model of Addis Ababa University working with a different universities. So university with university collaborations to really expand quickly the care that we need in terms of training, but also the quality of care that needs to be in place. And also expansion of chemotherapy is better. We are now having around 16 centers who are giving chemotherapy care. So we're also we're trying to enhance this through strong partnerships. I mean, partnerships are also always a foundation for enhancing care in terms of academia, and donors, private foundations and others coming together. So within this hubs and spoke model of Addis Ababa University, that's what we are now trying to push, have strong partnerships. And we're also now entering to the Race of Hope initiative that the International Atomic Energy Agency has launched with Africa Union around close to a year ago now, I think 6 months ago also. And we're part of that initiative to expand the care because even if we reach 6, it's a good expansion, but still when you look at the need, it's still very huge. A large number of our patients wait up to even more than a year or so, and some of them die. Many of them actually die without getting the appointment they should have gotten. So really expanding the whole continuum and including engaging communities in terms of course, advocacy for screening and improving the care is what we are envisioning. I may come back later if needed. Thank you.